My name is Mackenzie, and I'm going to be discussing the role of the nurse practitioner. So what is a nurse practitioner? There's a variety of definitions from various states, national organizations, federal law, and the Board of Nursing. But the Board of Nursing's definition of nurse practitioner is an RN who has earned a separate license as a nurse practitioner through advanced clinical nursing education in a distinct specialty area of practice. A nurse practitioner is able to diagnose, treat, educate, manage care, promote health, coordinate care, and prescribe. How does a nurse practitioner differ from a physician's assistant? So the differences are primarily in their legal definition, their licensure, scope of practice, and the independence of practice. A nurse practitioner follows a nursing clinical pathway, where a physician's assistant follows the medical clinical pathway. PAs practice under supervision of a physician, and depending on the state, a nurse practitioner can practice independently and even have their own practice. Most states require nurse practitioners to have a master's degree, and typically PAs don't require a master's degree. In terms of continuing education, nurse practitioners must log 75 hours in 5 years minimum, and PAs must log 100 hours practice in 2 years minimum. To renew a certification, a nurse practitioner must recertify every 5 years, and a physician's assistant must retest every 10 years. Nurse practitioners have specialty fields where PAs have a more generalized medication education and background. So more information on the educational differences between a nurse practitioner and a physician's assistant is that a nurse practitioner must earn a Bachelor of Science in Nursing. They must pass their NCLEX RN exam. They must go to a graduate school and get their graduate degree of a Master's in Science of Nursing or a DNP. And a certified nurse practitioner must pass the national certification exam in order to be certified. For a physician assistant, they must earn a master's degree in the Master of Science in Physician Assistant Studies. They must pass the PANCE exam, and they must maintain their national certification by continuing medication education. How does a nurse practitioner differ from a physician? So they primarily differ in scope, practice, definition, and education. The role definitions vary between states, like the definition of a nurse practitioner itself. For education, nurse practitioners mostly require a master's degree, where physicians require 4 years of med school and then residency in addition. Scope of practice. Physicians practice independently. Some nurse practitioners may require physician oversight, and again, that depends on state. Physicians are certified to care for complex medical conditions and perform specialized services, and nurse practitioners primarily work in primary care settings. So some may ask, why don't you just become a physician to nurse practitioners? And there are a lot of answers to this question. Nurse practitioners provide comparable clinical care compared to MDs. They both achieve similar quality of care in chronic disease management. Nurse practitioner patients are actually less likely to be hospitalized than those of MDs, and this may be due to the increased access patients have to their nurse practitioner due to the nurse practitioner's reduced panel size. They may have more sufficient time to manage their patients because of this factor. Nurse practitioners also have a nursing passion and a background. They often provide very thorough assessments and holistic care, as that's what nurses do each and every day. And nurse practitioners can also improve access to healthcare and primary care. Here are my references, and please let me know if you have any questions. Thank you so much. Bye.